Hi, I'm Megan McMaster, and I will be performing the NG administering medications as well as the IM and SUBQ medications. First, I would go get the MAR. I would check it over, then take it into the medicine room. I would double check the MAR again. I would pull the correct drugs, double check once it came out of the Pyxis that it was in fact the correct drug, the correct dosage, and make sure it was not expired. Once all those complete, I would go into my patient's room, perform hand hygiene, introduce myself. Hi, I'm Megan McMaster, or I am Megan. I will be your nurse today, and I'd be administering your drugs as well. I would ask to see the patient's ID band, have him or her read back their name, date of birth, and possibly the medical record number. Once that is all clear, I will inform them what we are doing today. We're going to be administering your medications through your NG tube. I'm going to don my gloves real quick. I have all your medications here. I have to crush them and put them in water in order to flush down your NG tube. So then I would, with the correct medications, if they're compatible, I would put them all in one after individually crushing. I would stir in sterile water, have that set aside, and any other medications that are not compatible. If you cannot crush, I would have to dissolve it in the water and continuously stir until it's dissolved correctly. Once that is all said and done, I will go to the NG tube. I will hold it up and I will occlude it first, pour 10 mLs of water, then slowly let go and let gravity take its course down into the patient. Once that is clear and there's no occlusions, I would then go back. I would grab my medications that I drew up. Once I drew them up, I would attach it to the top of the NG tube, slowly push down the medicine through and down into the patient. If there is no other medications, I would then be done. If not, I would then have to flush another 5 to 10 mLs, clean out the NG tube, let gravity take its course as well. Once it is all clean, then I would draw out the other medications, attach it to the top, and slowly push down and let the medication go into the patient. I will let the patient know that they're going to have to sit upright for about an hour to make sure the medication goes and digests down. And after the hour, I will come back and check on the patient, and then I can put the head of bed back down because I raised it 30 to 45 degrees depending on the patient. Once that is all done, I'll let them know that there is a call light to call me if there's any issues or if they feel like they're having an adverse reaction. I would take my gloves off, and then I'd go back to my station and I would document everything that happened. Next, I will do an IM injection. With IM injection, again, I will go get the physician's MAR. I will go into the Pyxis, the medication room, double check the MAR again, pull out the drug, check the patient, check it's the right medication for the patient, the correct dose, and make sure it's not expired. If everything again is correct, I will go to my patient's room. Hi, I'm Megan. I'll be your nurse today, and I'll also be giving your injections. I will ask the patient where they, first I will double check the patient's, if it is the correct patient, I will check their ID band, have them repeat back their name, date, date of birth, and their medical record number. Once those are all matched up, I will then draw up my medication for this. It will be 1. So what I will do is I'll pull back air, inject that into the vial, and then pull back to 1. Then I will put my needle on. I will uncap it. And if the patient does not have any preference on where the injection goes, I usually like to go for the thigh. Using the Z-track method, I will pull the skin nice and taut. I will inject the patient while holding the skin nice and taut. After injection, I will release the skin, pull back, and then I would cap my needle. If this was a pain medication, I would ask if the pain level has gone down or if it stayed the same. If it has gone down, then great. If not, I will monitor and check on her every 20 to 30 minutes for about an hour. If it still hasn't gone down, then I will check with the physician and see what we can do next, because maybe it was either the wrong medication they ordered or it's just not working the way it should. I will use hand hygiene and I will leave the room, and then I will document everything. Next and last, I am going to do a subcutaneous injection, and for that, I will again get the MAR, go into the medication room, check the MAR one more time with the Pyxis, make sure it was the right medication for the right patient. I will take it out, double check it is still the right medication coming from the Pyxis, check the dosage, and I will check the expiration date. Everything is good. I will go into my patient's room. Hi, my name is Megan. I will be your nurse today. I will perform hand hygiene, and I will don on my gloves. I'm going to be giving you your insulin today. Is there a place that you prefer it? Your stomach? Perfect. So what I'm going to do is I'm going to uncap my needle. The insulin calls for 10 units, so I will pull back to 10 units of air. I will inject the air into the vial, and then I will draw back 10 units of insulin. I will then go at a 90-degree angle, just like the intramuscular. Go straight down, inject, pull back. I will use the scoop method for my needle to recap it. And then I will ask her if everything feels all right, if she feels okay. Once everything is fine, I will then do hand hygiene and leave my room, and leave her room and go back and document. I also forgot, but I would make sure the patient had privacy before I did any of medication administration, and I would also clean the site, starting from the center, moving outwards with an alcohol wipe for about 30 seconds. And then I would perform the injection, just like how I just did. Pull back and finish.